Hi everyone, thank you for joining me on this video regarding Fudge surgery and recovery after surgery. Let me just give you a little bit of background. Fudge was bought from a non-registered breeder, if I can remember, 2015. And since 2017, Fudge had ear infections. So there was many vet visits. So fast forward until 2022. So regarding this video, you will see the first clips are from the first, I do believe, otoscopy being done. This is now almost a year ago. We are now in October 2023. He did not feel well after the otoscopy, and I had to fetch pain medication and antibiotics that was not given after the procedure. I gave him some vanilla ice cream and he started eating, as you can see in the video. He was shaved as well because he was a little bit matted. With the inflammation, you will see in the clip as well in the ear and bacteria in the ear, I tried to keep the flies away in the summer season from his ear. There was surgery mentioned to me regarding peekaboo ear surgery. The veterinary practice said both ears needs to be done. So let's call it my gut feeling or my intuition told me to seek a second opinion. And I am today very, very glad I did seek a second opinion. The second opinion also done an otoscopy and said only the right hand ear needed to be done for surgery. The second opinion also immediately started a treatment plan. We started off with the food. With this type of infection bacteria, normally it is the environment or it is the food or something that agitates and irritates, the dog. You will see Fudge had to be on Heels ZD for over a month. That pellets or kibble is a complete different protein from your normal chicken and beef. But because Fudge was on cortisone as well, that kibble never made him full. So he stole food. You will see that in the video as well. So before the surgery, basically the second opinion discussed with me step by step everything that's going to be done, the precautions, what can go wrong, and all that information, and I'm really, really glad about that. After the surgery with the cone, it had to stay on for 2 weeks. I slept on the couch for over a week with Fudge and Gus. I had to cut the cone a little bit for Fudge to be able to eat and drink water, as you can see that in the clips as well. Every time when Fudge ate something or got his medication, I basically cleaned the inside of the cone with lukewarm salt water and cotton wool to prevent further infection on the surgery and the ear. Fudge was basically an easy dog to give medication to. I used chicken and sometimes I used some toast. But luckily, and I'm grateful and thankful that he ate his tablets or medication quickly. Later on, I mixed the kibble or the pellets with Heels Senior with the ZD to help him feel fuller. You will see that as well. He slept well with the cone. And also I feel that this is very specialized surgery. So not a normal veterinary practice will be able to do this. And with the specialist doctor, again, he spoke to me, he gave me all the information, he told me all the precautions, what needs to be done. Also with the second opinion, they gave me like a letter after the surgery to tell me, for example, there might be a little bit of discharge, what can I do? And they kept me in the loop the whole time. There's also like a type of WhatsApp group if I had concerns. the surgeist, the specialist doctor also told me about the complications. Because with these types of surgeries, a lot can go wrong as well. After the surgery, as you can see in the video, he had to take a lot of medication. I had to give it to him throughout the day. Again, I used chicken, and again I used salt water and cotton wool, lukewarm water, to clean the cone to prevent further infection in the ear and just overall. So after 2 weeks, I took off the cone, and when the cone came off, Fudge was very, very happy, and the ear looked good. There wasn't any debris, there wasn't any infection or redness. All of this basically happened in the middle of winter. So it was not very, very easy. But I'm grateful that Fudge and Gus have a routine every day. I've basically placed, a type of routine, like in the mornings when they receive food, and in the afternoons when they receive food, and in the evenings when they receive cookies. So you will see in some of the clips, Fudge is asking for cookies because it's almost 8 p.m. I had to take Fudge to remove the stitches. That was a bit heavy for me. But myself and Gus was there for him. He was never alone. Fudge and Gus gets breakfast. Sometimes Fudge and Gus gets breakfast in bed. You will see that as well, because they are very spoiled dogs. When I took him back for the follow-up after the stitches was removed, he had ringworm on his nose. Due to the fact that his immunity was a bit compromised with the surgery, with the antibiotics, with the cortisone, and it's just basically everything, caused his immunity to fail a little bit. So the doctor prescribed a type of antifungal lotion, ointment that I basically put on his nose with a cotton bud. You will see that as well in the video. So as we progressed and Fudge got better after the surgery, and with his immunity being compromised, a skin yeast fungus came out again. Now this is called something, again, I'm not a medical professional or a professional person, but this is something called melanasia. Now, what is melanasia? This is basically a skin disease in dogs. It is caused by a fungus. The yeast is found on the skin, and it causes inflammation on the skin. Now, to get back to the first veterinary practice, that I had my doubts, and I sought a second opinion. It was possibly picked up already in 2018 that Fudge might be a very sensitive dog. He might be very sensitive to his environment or his food that causes this melanasia or this yeast infection. So my question is, why didn't we start with the treatment in 2018 already? Then most of these steps could have been avoided, or even the surgery could have been avoided. But again, I do believe that Fudge's history was not checked properly. So starch is not a very good thing to give dogs with fungal infection or yeast infection. Starch like bread, rice, and I've made the mistake. I sometimes gave them rice and toast, like I've mentioned earlier before. So with this skin disease or condition, there needs to be a treatment plan in place. And this treatment plan was only communicated to me within this year, 2023. And I mean, there's a history about it. But anyway, we move on from that and we take it day for day. So again, to get back to the white ointment on Fudge's nose, that's again for the ringworm. So I applied the ointment every day. You will see as well in the video with the melanasia or the yeast infection, there is skin discoloration. So the second opinion gave me a special shampoo that I had to bath Fudge with twice a week. But because it was winter and raining most of the time, I only could bath him once a week when there was sunshine, because the special shampoo needs to stay on his skin for about 10 minutes. I used plastic gloves when I applied the shampoo. I would suggest you read the description of the shampoo. It is especially made for cats and dogs. The shampoo is called Malasep. It's a very, very good shampoo. It's a medicated shampoo for derma care. So I had to take Fudge again for a shave due to the fact of the skin condition and due to the fact that I need to wash him now more frequently with this medicated shampoo. He wasn't very happy with me when I had to take him again for the shave. But this thing is, with this shampoo, it needs to penetrate his skin and get to the problematic areas. And it's also almost summertime, but most important, to be able to get the affected areas of this yeast infection to dissipate and get better. Fudge and Gus was not happy because I shaved them. As you will see in the picture, Fudge decided basically one afternoon, we basically put some fertilizer on the grass and soil, and Fudge decided that he's going to roll into the fertilizer and soil, and he's going to come into the house and he's just going to lie there in the fertilizer and soil. So immediately I had to wash him again due to the fact of the skin condition, melanasia or the yeast infection, because in fertilizer and soil there is also some sort of fungus, and we are trying to get Fudge away from the fungus. So he wasn't very happy when I had to bath him after he basically rolled in this fertilizer and foil. Up until this day, October 2023, the treatment is still going on as we help Fudge to get better day for day. And yes, it is getting better day for day. But the thing is, with this type of situations that you might experience with your animals, your pets, your dogs, your cats, is my final words. I would say, have a lot of patience. Have a lot of understanding of what they are going through. Try your best to be there for them. But also, the most important thing about this whole situation is that if your gut feeling or your intuition is telling you something about a veterinary practice, I would suggest, again, it's your choice, your decision, and again, I'm not a professional in this field. Ask the necessary questions. Let them communicate with you. Because with my second opinion, they kept me in the loop every time. They sent me, like for example, Fudge went for a few scans, biopsies, surgery, otoscopy. They kept me in the loop with everything. They mailed me all the information, everything that they're going to use. They communicated, they talked, they phoned me. That's very, very important. But if you do have a little bit of a gut feeling about a veterinary practice, I would suggest you seek a second opinion. Because the thing is now, Tikaboo is a very specialized surgery, and as the specialist doctor told me, that the dog might become deaf. It might sound like you're putting your finger in your ear or you are underneath water. He won't be able to hear that well than before. Now, for example, if I basically agreed that both ears received a surgery, Fudge would have been completely, or half deaf today. And if you look out through the clips of the video, you will see he responds. He responds to many, many things, even if he have a fractured, what do they call it, eardrum, or I think it's an eardrum. Because that is also, that came out. He said that he's got a ear problem in a sense of eardrum. But anyway, like I said, I'm not a professional, but let them communicate with you. Ask the necessary questions. Seek a second opinion if you feel unsure. I hope that this video could have helped a few pets and animals. Please let me know in the comments. Thank you so much. Bye.